Live from the Channel 4 studios in Boston, WBZ News at 5:30 starts now.
Well, the coronavirus pandemic is taking a toll on the mental health of many healthcare workers. They treat patients all day and often can't even return home to their families for fear of spreading the illness. A study looking at nurses and doctors in Wuhan, China, found that during the peak of the outbreak there were high rates of depression, anxiety, insomnia, and distress. Experts here are starting to worry about what happens to our healthcare workers after the pandemic ends. Here's WBZ's Beth Germano.
We sometimes forget in our quiet moments we need our own rescue.
Nurse Amy Smith has been on the job for 25 years, now caring for COVID-only patients at Brockton Hospital, saying it's an anxiety she's never experienced before.
There's an anxiety of anticipation. We're not sure what's coming through the door.
And she's now living apart from her husband and 2 children, out of fear for their health.
Now I have my loved ones to worry about. They're looking at me, they've got me to worry about. That's a stress I can't fix, and I can't make it go away.
The stress on healthcare providers in the midst of a pandemic is an increasing concern, that as much as they are giving critical help, they're not helping themselves.
We need to prepare right now.
Dr. Beth Lown, Chief Medical Officer at the Schwartz Center for Compassionate Healthcare, is concerned about a second pandemic, mental health in the healthcare community.
There's this culture of medicine where clinicians in particular are, and especially physicians, we're taught not to exhibit weakness.
Amy Smith says she's more likely to turn to a coworker who can empathize with her experience.
Sometimes we need someone to meet us where we're at, and a coworker can do that better than somebody who doesn't know the backstory.
Just as important as personal protective equipment, masks, and ventilators, experts hope hospitals are also taking the mental temperature of their workers.
And that's why things like psychological first aid, stress first aid, peer support programs are very, very important right now. Some organizations have them built in, some do not.
There's no face to it. There's no, I can just avoid it.
Amy Smith trying to chart a course in uncharted territory. Beth Germano, WBZ News.